Hi, I'm Don Mackey, LCAT Director, and I'm back with Health Director Amy Petrosky to continue our series of updates relative to COVID-19 in East Long Meadow. And today, we're going to talk about the difference between, or the distinction between isolation, quarantine, and what it means to be a close contact. All of those things are sort of part of the framework of what people are dealing with right now. So Amy, thanks for coming back.
Yeah, of course. Thanks for
And
having me.
so what are the distinctions between those terms, isolation, quarantine, and then what does it mean to be a close contact, and what does being a close contact mean for someone?
Yeah, okay. So the major difference between isolation and quarantine is those who are placed under isolation have a positive test result already. So if you get notified that you have tested positive for COVID-19, it means that at some point you were tested and they're letting you know that you are positive and that what you need to do is isolate yourself. Now, isolation can mean different things for different people depending the setup of their homes. For some people, it's, they have a master bedroom and a master bath and they just stay in that space and the rest of the family occupies the rest of the house. For some people, that's a little bit more challenging. And so everybody wearing a mask while you're sharing the same common spaces is the way that some people isolate. If you are identified as a close contact, so that means you have been in contact with someone who has tested positive closer than 6 feet for 10 or more minutes, and that's cumulative. So if you're with someone 5 minutes in the morning, 5 minutes in the afternoon, and 5 minutes in the evening, less than that 6 feet separation, you will be considered a close contact. So it's a cumulative 24-hour period. And the way that someone identifies you as a close contact is once they're contacted as a confirmed case, either by the public health nurse or by the Contact Tracing Collaborative, which is the organization that the governor has set up to help local health departments do proper contact tracing. The people who are positive are asked, who have you come into close contact with? And they'll have some triggers to say, like, who have you been to work? Have you gone to any sporting events? Do you participate in any sporting events? Do you attend in-person learning? So there's a variety of questions to help flesh out who may have had a close contact. Right. And one of the things that's important that isn't always known is people are contagious up to 2 days before they start showing symptoms. So if I start feeling sick on Saturday, they're going to ask me to talk about my close contacts starting on Thursday. So at work or at school or at sporting events, back to that 48 hours in advance. Close contacts are then notified by the public health nurse or the Contact Tracing Collaborative, we'll just call that the CTC moving forward. And they'll be notified that they need to quarantine. And what quarantine means is that you need to stay inside your house and monitor yourself for symptoms of COVID-19 for 14 days. And the reason that it's 14 days is because that's the longest period that we know that people can still become infected. The average exposure time for when you're exposed to when you test positive is 5.1 days, but there are some people that will show positive as early as 3 days and some that will show positive as late as 14 days after exposure. So that's why they use that 14-day period. If you're under quarantine and you start to develop symptoms, you get tested and you become a case, they would move you into isolation and then do all your close contacts. So it moves one step further. One of the important things that we're finding, especially in the last couple of weeks, is once you get tested, if you have a reason to be tested, whether it's you were identified as a close contact or you are not feeling that great or people around you are sick and you're trying to just make sure that you don't have COVID, is after you're tested, you should be quarantining, right? So what we're finding is people get tested and then they're continuing to do their daily life while they wait for the results. And unfortunately, what happens is then we create a lot more close contacts and we expose a lot more people to the virus than if we had just stayed home while we waited for those results. So I hope one of the important things that people take away from this is if you get tested, stay home while you wait for the results. So that would be considered quarantining till you get the results. And I don't know if we mentioned earlier, but isolation is for 10 days. And there are two different protocols for how you determine the 10-day period. We know that about half of the people who contract COVID are asymptomatic. So if you're an asymptomatic carrier, positive, your 10 days starts from the day you were tested. So if I was tested on Saturday, my day one would start that Sunday, and it would go for 10 days. If I was symptomatic and say I started to feel not so great on Saturday, but then I didn't get tested till Monday because I realized, hey, this isn't getting better, I should probably get tested. They would go back to my symptom onset date. So they would still start on Saturday, even though my test results came back on, I was tested on Monday.
Okay.
So there are two different ways that they consider that 10-day period.
All right. And so if you feel lousy on Saturday and you get tested on Tuesday morning,
Mm-hmm.
and you get your test result Wednesday night, right, as positive, and you are then told you have to go into isolation, are you then only isolating for Thursday, Friday, and Saturday?
Yeah, so your isolation would be much shorter. It's tricky when you count out the isolation days and the quarantine days because, so if they started feeling sick on Saturday, you would start counting on that Sunday. You'd count out 10 days, and they aren't released from that quarantine until that 11th day. So people sometimes forget. So I think I think you had said 4 days. I think it was 5 days.
I didn't have it right, but the concept is the same.
Much shorter.
It's a shorter period of time. Okay.
Correct. If you are feeling ill or you've been exposed, well, actually, let's just go with if you're exposed. So here's one of the other things that we're finding that the community could improve the process on. So if, Dawn, let's say you and I were having this meeting in person and we were sitting across the table from each other 3 feet, and you call me in 3 days and you say, hey, Amy, I tested positive for COVID and I was with you during my symptomatic period. Most people get scared and they freak out and say, oh my God, I gotta go get tested for COVID. I was with Don Mackey while he was contagious. What would be in their best interest is to wait 5 days from that exposure day, because we know the average incubation period is 5 days.
Okay.
So if I was with you today and you let me know, today is, what day of the week is it? Tuesday. It's Tuesday. And you let me know tomorrow that you tested positive, I should wait Thursday, Friday, Saturday, Sunday, Monday, and get tested on Monday. Because if I got tested tomorrow or the day after, my body hasn't built up enough of the viral load in my system to actually test positive.
Correct.
So if I test too early, I'm not doing myself any good. But people
or anybody else.
Or anybody else. But people are, rightfully so, when you find out you were exposed to someone with a positive, your immediate instinct is, oh my goodness, I should get tested so I don't get my family sick, or I don't bring this to my mother, or, a variety of other things. But waiting that 5 days post-exposure is going to give you the best results possible.
However, just to clarify, in that waiting period, you should be cautious about.
You're under quarantine.
You're under quarantine.
Because I would be considered a close contact to you, and that's why I would be notified.
Correct.
I am under quarantine, so I'm still staying in my house. The only change here is that I'm not rushing out to get tested as soon as I find out.
And so the scenario where someone does consider the fact that, well, say there is that exposure, and then goes within a day or two to get tested, happens to get a quick turnaround on the test and gets a test result that says negative on essentially the 4th day after the presumed exposure. Mm-hmm. Does that not lead to the conclusion that, well, I got a negative test, everything's fine, and You know what I mean? I mean, is that,
Yeah,
I
so
think
a
we've seen
negative,
that scenario play out in some sort of high profile instances.
yeah, a negative test is not uh, a, a removal from quarantine. Even if you get a negative test, you're still under quarantine. What it really helps you do is protect the people in your household.
Right.
So if you are waiting to get that result at a time period where you are most likely to have enough viral load to test positive, you're able to best protect the people that you're around. Because no matter what, you're still under quarantine. The negative test does not say, okay, now I get to go back to living my life.
Right. And that was the point that I was trying to make.
Yeah.
Because I think there is a perception that might be the case.
Yeah. And a lot of people don't understand how we identify close contacts. So I had said earlier, it's less than 6 feet apart for 10 or more minutes. Now, there's also one other way that you can be considered a close contact. So if Don, you and I were sitting 3 feet away across from our desk having this conversation, and you were to sneeze, right? And we were only together for 2 minutes, but you sneezed and you did the best you could to cover. Because of that high velocity of the sneeze, that viral load is much higher than it would be during normal respiration rates. So Don, if you were to get a call from either the nurse or the contact tracing team, they would say who you've been close contact with. And if you knew, like, hey, I was with Amy, we weren't together for 10 minutes, but I was sneezing and coughing while we were together, they would consider me a close contact.
Correct.
So those are the 2 ways that you can be considered a close contact. Now, if you are looking to get tested, there are multiple places you can go, your primary care, a walk-in clinic, and also now the governor has extended the availability of the Stop the Spread sites. So we have a variety of Stop the Spread sites around us. And I am seeing a much faster turnaround from the Stop the Spread sites than I am at like the walk-in clinics. The walk-in clinics tend to have a longer turnaround time. Maybe I don't know if it's because the lab they're using or the volume that they're doing, but I'm seeing 24 hours for the Stop the Spread sites and sometimes up to 5 days for the walk-in clinic.
And people can find the locations of those Stop the Spread sites on the the COVID dashboard, or?
Correct. Yep. The DPH website has a link to all the Stop the Spread sites. You can search around you. You can put in the town that you want to go to. And, I know there's some at Holyoke Community College, tent that gets set up on Appleton. In Holyoke, there's some in Springfield.
Okay, but they're available.
Might be over. They're available all over. And you can go to any one in the state, and they're all free. They don't even ask for your insurance information. You go, you tell them, I'm symptomatic or asymptomatic, and they go from there. There's no insurance information needed. If you do decide to go to a site that's not a Stop the Spread site, something that is really important is that you make sure you're getting a PCR test. That's the gold standard. The other test that is out there right now is called an antigen test.
Correct.
And the state doesn't accept that as a valid result because it's 33% inaccurate in both directions, false negatives and false positives. So any antigen test that is done is required to be followed up with a PCR test. So you're essentially getting 2 tests when if you just started with the PCR, you would have what's considered a valid test result. So if you're shopping around and trying to find a place to go, that's a question that would be a valid question to ask, and ensuring that you're getting a PCR test. Some employers will only accept the results of a PCR test because that's what DPH has suggested.
That's right. Okay.
Okay, so if you are positive, like I mentioned earlier, you would get a call from either our public health nurse or the CTC. They would notify you of your positive results, sometimes even sooner than when your doctor notifies you. And the reason that happens is because just like any communicable disease, there's a tracking system that the state has. And as soon as the lab gets that result, it goes right into a system that notifies the health department. Sometimes your doctors might not make all their calls until the end of the day or their lunch break. So if we're notified at 7 a.m. of a positive and your doctor's seeing patients all day, we may be the first person you hear from. So if you see a call from, it would say COVID-19 team on any caller ID, that's the CTC team. It's really important to answer that because they're either alerting you that you are positive or that you've been identified as a close contact. So taking that call and finding out what you might have been exposed to and what you should do to protect yourself and your family is important. The other thing that's important to mention here that maybe hasn't been stated strongly enough is that if you are positive, it is really important to identify your close contacts. No one gets in trouble. You know, we have access to translators that if English isn't a first language or there's more preference to speak in that language, I don't remember how many languages CTC has access to, but it covers the gamut. Also, there's ability through my office or the CTC to request support. So if you live alone and you can't go to the grocery store to pick up toilet paper or groceries, or you need support with housing, those are ways that you can access services that otherwise you wouldn't have access to. And it's a really confidential, easy process. So sharing those names is the best way to protect those around you. Your name is never used. And it really helps us to prevent the spread of this virus going further. I mean, as we see that we're in red right now, I'd love us to get back down into a different color range, but the only way we can do that is if people in our community are wearing their masks, staying 6 feet apart, and if they are positive, staying at home and identifying the people they've come in contact with so we can prevent them from spreading it to other people.
So Amy, one last thing in terms of people contacting the health department, if they have more questions or want to clarify some of this information, you're available by telephone, and we'll put the information up here and through your Facebook page and the town website. So you want to just confirm that for folks?
The health department is happy to answer. This is a confusing, I mean, we just kind of gave it a 101. It's confusing. It's the contact tracing, who is a contact, the difference between isolation and quarantine, how that time frame works. It's confusing. So we're always happy to walk that process through with you, even if you're not exposed or you just want to know how to better protect yourself. We're here, and these are the questions that health department is designed to help you with. So use us anytime.
All right. Well, I think this was extremely informative. Thank you, Amy Petrosky, Health Director for the town of East Long Meadow. And we will plan to do this again in a week or so, and just try to keep following up with information as you want to share it with the community. And thanks very much again for coming by, and we'll see you next time around.